Good morning, good afternoon, and good evening. Welcome to the 571st day of continuous Zooms at IFPH. Today, we have with us Dr. Sadath Sait, PHMS, Director and Chief Physician, Dr. Sait, Homoeopathy, Kochi, with more than 25 years of experience. And the topic of presentation is venous ulcer and its management. On behalf of IFPH, I am once again welcoming Doctor. You can have the platform for the next 45 minutes. Over to Doctor.
And thank you once again, IFPH. Okay. This is a topic which not too much of interest, but it's not little tough. It's the toughest for the homeopaths to treat. Why I got into this is because of my own wound. My own wound. I had a wound in my leg where I couldn't dress myself. As a homeopath or as a homeopathic doctor, I tried many in and around Ernakulam. Even tried in our what are called medical centers in government medical dispensary also, to get a nursing who is an equipped, or a doctor, homeopathic doctor who is equipped in dressing with homeopathic medicine. I didn't want to do a betadine this one, because when I did this, when I got this, I went to, because I couldn't dress myself. So I went to an allopathy hospital. He started making a fun of me. You have to go into the you have to be admitted. You have to go to the OT. You have to clean up all the sludge, then dress. So a small wound, they will make it a big, then they will heal it. So it will take another 2 or 3 months to heal. So this was a challenge in front of me, because being a homeopathic doctor, no one, 90% majority people is not aware of what kind of a dressing has to be done, how the dressing has to be done. Everyone knows materia medica. I don't know, I'm talking about at least around 5-6 years back. But somehow I tried myself, because it was too paining. So somehow I managed for 3-4 days or few days. It got healed with our medicine and this. Then I realized this is the biggest challenge we are facing it now. Let's do it. If some this one comes up. So varicose vein, first I thought I will have to present it to the people. So I made a big board. Varicose ulcer will be treated here. Slowly response started. Now at least monthly I get 7 to 8 cases of varicose ulcers. Minimum. So this is something which homeopathy has a big scope. No surgery, nothing. Homeopathy has the biggest medicines, the best medicines possible. So I thought I will share this with you. I don't know how far homeopathic fraternity is going to take it or no, but this is what I have been doing it. This is what I have done it. So let me start with what is varicose vein, what is varicose and basics anatomy. As it any subject of clinical medicine, it has to start from embryology. I believe it from the embryology, anatomy, physiology, step by step, because we are not thinking about that. If we don't know anatomy, we are not getting the miasm of it. We are not getting the pathology of it. So that's a basic thing which I always tell my juniors, as well as I always do that. This is a varicose vein.
Yeah.
Okay, that's the first introductory page. The varicose veins, you know that veins of the lower limb drain deoxygenated blood and return to the heart. That's called varicose veins. Veins functions. We have two kind of a vein, deep vein and a superficial veins. Okay, this is a basic. I'm just running off the anatomy, but basics we should understand. Deep veins are the lower limb. It is covered under the vascular sheath. It is covered along with the artery, as well as the veins are in a vascular sheath. Why have the God has given that kind of an anatomy? Why the artery has to be with the vein? So venous pressure or venous pulsation happens because of the arterial beatings. Arterial pulsation pushes the venous blood. They push the venous blood up. So artery has to pump properly, then only veins also can function properly. This is the anatomy, or this is what God's engineering. The basic engineering of venous functioning is this one. Okay. The main venous structure of the foot is we have a dorsal venous arch, anterior tibial vein. These are the basic two veins. We have it on the plantar aspect, means on the foot. Plantar veins, posterior tibial and fibular veins are there. Entering the anatomy, if you want to do, it enters the medial malleolus of the legs. We have a popliteal vein which goes behind the knee. That's called popliteal area and abductor canal. Popliteal vein enters the thigh via abductor canal. Okay, I'm just rushing it just because you have to be little familiar with the names. I know we all have forgotten all this, because 90% of the case nothing comes to the thighs or anything. We try only for the veins and we just pressure. The thighs, femoral veins are the deep vein of the thigh. Is another main venous structure in the thigh via perforating veins. Okay, these are the femoral vein leaves the thigh but underneath the inguinal ligament. Inguinal ligament, at which point it is known as external iliac vein. So from down it is coming into the external iliac vein. Okay, then in the gluteal or buttock region it becomes inferior and superior gluteal veins. Then we have a deep vein, we have a superficial vein, subcutaneous tissues. Superficial veins are the lower of the lower limb, runs in the subcutaneous tissue basically under the skin. Okay, we have a great saphenous vein and great saphenous vein and the small veins. Great saphenous is formed on the dorsal venous arch and dorsal vein of the great toe. This is superficial veins, medial malleolus, and comes up. This is a basic diagram of what we have to go through. As it is coming to the inguinal ligament, then it getting into the small saphenous vein, the great saphenous vein and the small saphenous vein. It's all the same popliteal vein, then goes into the inguinal, then becomes the iliac vein. So now is a basic anatomy. Now varicose veins. What is called varicose vein? Varicose veins are twisted, enlarged veins. Any vein that is close to the skin surface, superficial, can become varicose. Varicose vein most commonly affects the veins in the legs. That is because, and we have every place in the scrotum, we have it in the rectum, we have it in the liver, portal hypertensions. All that comes as the varicose veins. Okay, now varicose veins. What are the symptoms? We basically feel that patient comes and says that okay, there may not be a varicose veins expression, but varicose veins basic symptoms can be, it may not cause any pain. It can cause dark purple or blue colors. Veins, because the blood gets stagnated and it can become a blue color of the skin. Or where the veins go, that can be a blue color. Okay, when painful signs and symptoms of varicose vein occur, they might include an achy or heavy feeling of the leg. People come and tell that, doctor, I don't have, my legs feels heavy, or there is something which I'm not comfortable with my leg. That could be one symptom. Burning can come, throbbing can come, muscle cramping, swelling of the legs. That could be one symptom. The worsened pain after sitting or standing for a long time. People will not be able to sit or stand. Long time sitting or standing is the one symptom. Changes in the skin color. Okay, that could be another symptom which guides us to start medicines. The following can increase the risk of developing varicose vein. These are something which we allow to think about it. The age factor is the biggest factor. Age factor because all the vein anatomy gets loosened, valvular structures get loosened, Wear and tear causes the walls to function less. 6. Women are likely to develop the condition. Hormonal changes before the menstrual period or during pregnancy or menopause might be a factor. Okay, that could be another factor. So male female ratio, females are more affected. Pregnancy is because edema is more. Hormonal changes comes in. And there's a family history. Obesity is one of the big factor. It's a cosmetic factor as well as a genuine factor. Standing or sitting in a long time, especially the ladies of textiles, because I have a lot of textiles in between. Okay, textiles. That's something makes it. Okay, and IT people sit for a long time. Now work from home has become a no. So IT people, even the doctors, we sit on a chair for a long time. We don't walk, we don't get up. So that becomes another. We are also occupational. We are also facing the occupational hazards in a varicose vein. Okay, weak or damaged walls can lead to the varicose veins. Arteries carry blood from the heart to the rest of the body. Veins return the blood from the rest of the body. Okay, muscles contraction. That is the one another thing we'll have to take care of it. Lower legs act as a pump. Elastic veins, walls help. So the muscles become the contracting factor, and more blood is sent to the heart. Okay. So classification of chronic venous insufficiency. How do we classify? How do we find whether this is more dangerous or that is more dangerous? So there is called classification. C0, no visible or palpable signs. There is no visible or palpable signs. She might or he might come up with small uneasiness of the legs and stuff like that. Then C1, small naves. You must have seen some protruding one reddish color capillary veins, telangiectasias and reticular veins. Then C2, varicose veins. C3, edema. When it is associated with varicose vein and edema, it's called C3. C4A, mild skin changes due to the venous disorders, pigmentation, black pigmentations of the legs. If it is associated with the diabetes, it is more. C4B, severe skin changes due to venous disorders. Dermatosclerosis. Sclerosis means our skin becomes like wood. It just the contractions and muscle movement gets, skin becomes dry and skin becomes thick. Atrophic blanches. C5, C4 along with healed ulcers. Can be small ulcers might come and it becomes ulcers. C6, skin changes with active ulcers. Okay, these are the active ulcers. What we are going to deal with this today. And complications. We know this one, blood clots. Deep vein thrombosis also can happen. Otherwise, blood clots can also happen. Ulcers can happen. Bleeding. Bleeding is another very dangerous thing along with the ulcers. How do we prevent it, or how do we manage it? How do we try stopping? Or we say the prevention is better than a cure. So this is more important. Avoiding high heels. Why do we have to advise ladies with small little pain or something of that sort in the calf? Tell the ladies not to wear high heels. I know that people now, if we say that not to wear high heels, it becomes very difficult. Eating a high fiber and low salt. We have to eat with low salt diet, high fiber. Exercise. A small leg massages. Okay, from down to up. This can also prevent it, so that our veins can work little more better. Watching your weight, obesity. You have to be careful. Improving blood flow and muscle tone. Muscle tone. Okay, so some kind of a gym or some kind of weight training of the leg can also help you. How do we diagnose as a varicose problem? Do a physical examination with inspection. Inspection we will come to. Then palpation. What is Das saying? Das saying is a tourniquet test. Wherever we do the tourniquet, we can come to know that whichever the position the veins are enlarged, we will come to know the tourniquet test. or else go for a, nowadays latest all this coming up, go for a Doppler ultrasound of leg, both invasive test. It's a Doppler test, so it's not invasive, it's an ultrasound. Easily the flow can be found. Then management, general management, self-care, such as exercise, all this can help us. Stockings, thick stockings, so that circulation becomes little better. Compression stockings, we say compression stockings, but one thing I've seen come with the compression stockings is the pain gets more. Pain becomes more, and the pains become worse in the night. And once we wear this, it becomes heat. First of all, it's a hot night, it becomes hot. So I don't advise more to the compression stockings. Manage weight, avoid salt, choose proper footwear, avoid tight clothing. Tight clothing around the waist. That becomes, don't wear tight clothes around your waist. Some people becomes very sensitive. The medicine clearly tells that if the tight clothing around the waist become very sensitive, we have the medicine, and that can be the clinching medicine for any kind of ulcers. We know that. I'll come with the medicines part later part of it. Raise the leg. Avoid long periods sitting and standing. It's something which is easier. So for a textile person or a person working in a textile, lady working in a textile, asking to change the job is not an easy job, job, because their family will be surviving on this. So we'll have to be very careful. Surgeries and stuff like that. That is what I also thought about. This is the only way of dealing the ulcers. I also thought, we are also not new to this. We are also what I call working on it, daring to take the cases, risking about our own reputation. Because people have to trust us, because such a wound, trusting homeopathy is not easy. But people nowadays, they trust us. Catheter based, these all things which we earlier we thought, okay, this is the only what I call, that is the only thing left out. Okay, now we'll come to the main topic, venous ulcers. Venous ulcers is the most complicated stuff in the venous, this one, varicose vein. Venous leg ulcers are the late manifestation. C6 classification is C6. Chronic venous insufficiency that can cause disability and serious complications. The elderly are more commonly affected. It's a complication of varicose vein or deep vein thrombosis. Venous leg ulcers are late indicators of the chronic venous insufficiency C6. In normal condition, calf muscle contraction and intraluminal wall propagate the flow. However, the retrograde flow, obstruction over both exist. Retrograde flow as well as the obstructions. The resultant chronic venous hypertension is responsible for the, with the flow back and obstruction somewhere, what happens is venous hypertension increases, venous tension increases, venous hypertension it becomes is responsible for the dermatologic or vascular complications that culminate in the formation of venous leg ulcers. That means venous, what are called, hypertension comes in the leg. Just like any other hypertension, we get venous hypertension. Stages of the development. Skin redness, first it could be skin redness and inflammation of subcutaneous tissue. Thorough inflamed skin starts leaking. Then appears whitish, small areas of dead skins. Then form the wound. Okay. Venous ulcers happen when there is a break in the skin on your leg, usually around the ankle. It may be due to the previous leg injuries. Whenever we have something, we get prone to get injuries there only, especially with the legs. Varicose veins, that also can cause the stagnation of the blood flow and the oozing can come. Varicose veins. Smoking is another one. Obese. Have had the circulation problems such as blood clots, phlebitis, painful swelling of the veins, cellulitis, that can also cause another ulcer. Pathogenesis. Chronic venous insufficiency may develop due to the blood reflex obstruction combination of both mechanisms causing macro. The increased intraluminar pressure causes the protein extravasation and fibrotic cuff formation. There is a clot there. So that means block of the vein. Another is failure of the reflex. Of the valvular reflex goes down, just like mitral valve regurgitation. Here also valvular regurgitation happens. That's another pathology. Okay. This one, chronic venous hypertension around the ankle causes hemosideration deposit and subcutaneous plain lysed RBC. RBC also get damaged here. Leads to eczema, dermatitis, lipodermatosclerosis. Lipodermatosclerosis is basically that our skin becomes very shiny, very thick. That is something which happens. Fibrosis, anorexia, and ulcerations. Okay. At a cellular level, the leukocytes, because when there is an inflammation, the leukocytes comes in. Then all this, what about this? Influx to that place happens. Then there is a metalloproteinasis. This is all basic issues. Fibroblast differentiation amount. That's too into academic. What as a clinician we need to understand just how this ulcer is there, what is the clinical manifestation, and then how do we treat it. Ultimately, chronic inflammation and incompetent blood flow. Okay, forms this one. Together, this inflammatory cascade of events impairs the healing process, which results in ulcer formation upon the wounding. Okay. What are the symptoms? Same. Rash or dry skin, brownish discoloration, foul-smelling fluid oozing from the sore. Again, ulcer can also become infected. If that happens, you might notice a redness, swelling. We say that cellulitis, thrombolytitis, eczemas, lot of things. Fever, pus, every little thing. Don't think that we will not get anything in this. We will get every little thing. It is really scary. It is really dangerous. It can go into septicemia. As earlier, if there is a problem with, if the patient is a diabetic also, diabetic foot ulcers as well as varicose veins are the difficult cases. So prevention, you all know that it's a basic, this one. Examination, X-ray of the area. X-ray is another important thing to find out what is the depth of the wound. Has it infected into the bones nearby, because medial malleolus is a spot, so there is a chances of it going into the osteo. This one, it goes into the bone. Inflammation of the bone can happen, and CRP can be high. CBC has to be done, and this is the basic test. General, all that is there. These are the few cases I'm going to put it. It's not. This is not the. So what happens is we were not tech savvy earlier. We bring the patient, we treat it. We don't make the what are called slides or anything. Recently we started. So recently started, and we are getting the fresh cases. That's where I'm putting it. Patient is a shallot. She's an athlete. This was a case wound, 2-3 years duration. It just got healed in 1 week's time. Okay. Medicines and how did I manage? I will tell you. These are the 3 cases I'm going to put it. This is a case of Mary Philomena, a 70-year-old. This lady with what are called varicose ulcer. Even they did a skin graft. 10 years of duration, didn't heal it. First was the case. Now the case is this. It is totally into the healing process. It can heal anytime. Only we are waiting for the skin to come. This is a slowly process. This can heal. Okay. This is Princey. If the full wound is deep down, and this is the result. Now we are going for a here what we have to think is she's around 35. What we have to think is a cosmetic effect also. We have to clear the skin. That's what the treatment is going on now. 35-year-old lady with a lot of cosmetic value. So, now the best part of homeopathy is the medicines, and just not the medicines. I ask all the patients, if it is nearby, maybe around 10, 15, within 10 kilometers, 15 kilometers, to visit me alternate days. I clean up. First, if there is a slough, remove the slough. Use a scalpel. Use the rectified spirit, even the spirit lamp, and sterilizers. Slowly sit and patiently sit and remove the slough. It might take first or 2 or 3. I mean, it might take little more time. I had a case even of a maggot. Maggot in the sense, heavy maggot, complete. It was like a rotten meat. It took 3 months, at least 2 3 weeks to even remove, pluck one maggot from the each and every maggot from the this one, and clean up with hydrogen peroxide with that kind of a maggot. First clean up, let every maggot come up, then first clean up with the hydrogen peroxide, then go for our calendula, echinacea, and other dressings. If that kind of a maggot formation is there. Otherwise, if it's not maggot, it's only involved with the muscles. If it is, however, the what are called stinking, what is the word called? Pungent, or what was that? That bad smelling, purulent, we clean it with our own medicines. The dressing I do with calendula if there is no pus. If there is a pus involved, clean it up with echinacea. Another one we use it is myristica and our curcuma. These are the 4 basic medicines we use. We keep changing it also. We even think about, we first RS cleaning, rectified spirit. I use only rectified spirit, not the surgical spirit to clean it. Rectified spirit, we get it in what are called 10, 12, 100 ml pack bottles. We buy it every time. We keep it as a stock and clean the wound meticulously. It is a painstaking. We will have to take care of the patient, because some patients have become too nasty, pain. They will even kick us. So we have to have some patience. We have to ask the patients to be calm down, because they have suffered a lot, and they have come up to us with rare hope. Someone told them, okay, go there, you will be healed. They don't have faith in homeopathy. First, they come with that. Okay. And we slowly take it up. We talk to them nicely, make them calm, start cleaning up. It takes a meticulous phase. Have to have patience. We cannot just treat like fever cases. So take time. These are the 4 medicines. Basically, we use it for the cleaning, clean and dress. Dress cleaning, then make a swab of cotton and gauze. Keep it there. Calendula dressing or echinacea dressing or any medicine we dress it. Keep it there and dress it up with a proper gauze. We need to learn that technique. Even that has been taught properly by a nurse who came to my clinic for the varicose vein. She taught me how to dress up properly. We have done it. We have done it in the college, but techniques have changed. All the dressing things have changed. How do we dress it? That also have changed. So how to tie that gauze in a proper way with the proper tight. Only thing we have to see to that it is not tightened too much. It has to be enough, tightened enough. We know that how it is. With the experience comes up, we will know, or the patient will tell you, okay, it's paining too much. Don't tie up tightly. Okay, I tell all my whenever the patient comes, I call my that staff. We ask them to train my juniors also, because she had been working in a general hospital for a long time. So we have to, or irrespective of egos, we have to shed every little thing to learn something. Even if from the junior, even if from someone, if someone teaches you something, you have to learn. Okay, now the Metria Medica. See, Metria Medica, the basic medicine what we treated is the Vipera. Indications can be many. Vipera main indication I go is what is it? That um, putting the leg down makes it the worst position. That's the hanging the leg. Elevation becomes better. That's the only indication we think about Vipera. Vipera arsenic album. Arsenic album is a what about this one? What about carries blood? Even for the gangrene, arsenic album is better. Trampling, you will have an what about tingling sensation. Burning is more. Cramps. Arsenic album is the better one. Acid nitricum, that's one of the best for the ulcers. Acid nitricum, Merxol. I'll tell you, I'll tell you in a little speeder way. Medicines what we mostly use is acid nitricum, Merxol. Syphilinum is another one of the best medicine for the ulcers. Syphilinum 1 every 2 hourly, half an hourly, 30 minutes. It's one of the best medicines. CKL core. Without CKL core, how can we treat ulcers? Nitric acid, CKL core, lachesis. Lachesis is one thing when the patient tells, okay, doctor, if I tie something here, it becomes very sensitive. On this one, people will come up with that Indian ladies wear the sari. Sari becomes the tie. They use the we call petticoat. So that becomes a little sensitive, and that is one symptom we get it even in the case of this one, sloughed. Soranum is another one medicine which we can rely on if the ulcers are very bad, if the skin is becomes not healing, if the skin is dirty and offensive. Gunpowder, anthracinum. Gunpowder is damage that will heal even the cellulitis. It will stop the prevention of cellulitis. Staphylococcin is without staphylococcin. I would say, in my experience, without staphylococcin, it's very difficult because secondary inflammation, secondary infections can be prevented with the staphylococcin. I go for a because it's a sarcode. This one I go in for a higher potencies, 1 m, 10 m, frequent repetitions. And all the medicines I give it as a frequent repetition because I feel the pathology is there. We are trying to bring out the blood, proper pure blood to that place. We are trying to heal it. Healing process has to happen naturally, so that medicine has to push on. I know indicated medicines can heal up, yes, but indicated medicine I cannot take risk, so I give this way. Lachesis, okay. Carbovage, without carbovage, no medicines. Carbovage is a slow one. Calcarea cough, everything goes slowly. Carbovage is a even oxygen, it takes the oxygen to the place. And 90% of the medicines which we use for the hemorrhoids can be used here. Another best medicine is Aesculus glabra, not Aesculus. Aesculus hip also is very good, but glabra is a portal vein congestion, so that is more dangerous. So apply it here also. Then Blumia, Neguntium, Synodem dactylium, Atista indica. Atista indica is one of the best medicines we can use it. What does that Atista indica? There's a particular, this one is legs feel sleepy. In a local language, they come and say, doctor, I don't know whether the leg is there. It is like too numb. I cannot even lift the leg. So it is like a sleepy stuff. So Atista indica is there. Then geranium make. hydrocyanic acid, polygonum punctuatum. You can all refer in the all these medicines are there in the boric. I'm not talking something from the my own Metria Medicare. Staphylococcus, soranum, hydrocyanate, geranium maculatum. These are the blumia, negundia, megil mermalosa, and phosphorus. Phosphorus is one of the best medicine. If you tell me what is the medicine which is available, mostly I buy it at 3-4 bottles of phosphorus 30. Without phosphorus 30, my clinic is shut. It's almost like a shut clinic. But everything from the respiratory to the fever to the COVID to to varicose ulcers, phosphorus is one of the leading medicines. Then we will have more itching. Podophyllum. Podophyllum is the one medicine which my juniors have taught me. The itching of the in the night, very severe itching. Itching is more. If any patient comes and tells me that there is a more itching, podophyllum. These are the few medicines. These are the way I treated. I don't know. Many of might have treated in a different way, but this is something. And the success rate is almost 80%. You can say it is 80, 100%. I can tell you it's 80% success. If the patient cooperates, and we can heal it in maximum. The worst to the worst is 3 months. Worst to the worst case is very 3 months. So cellulitis case, cellulitis restox. If this phlebitis and cellulitis and this stuff comes up, restox. Higher potency, not 30, higher potency, 1 amina. So these are the medicines, these are things which I use it.
Yes.
With this, I think I've given my experience.